Indian government spending on healthcare was only around 1% of its GDP last year, and that's the world's lowest. But Prime Minister Narendra Modi is trying to improve that, as his government announces a sweeping health insurance plan to cover 100 million poor families. But with a dismal health infrastructure, there is much more to be done, including building a robust primary healthcare system that currently does not exist at all. Our correspondent Shweta Bajra has more.
Last month, Indian Prime Minister Narendra Modi announced a new healthcare program giving 500 million poor citizens free healthcare access, an issue long ignored by successive governments in India. The health insurance plan that would offer 100 million citizens up to 500,000 Indian rupees, or about $7,600 per person. The funding of the program, though, will be a struggle.
I think this will force all the private sector and the doctors community to build up hospitals in smaller areas. If you can have Coca-Cola, Pepsi, burgers reaching a remotest of the area, why we are not been able to have the health facilities there? With this insurance policy, I think the facilities will be in every corner of the country.
The insurance will allow India's poor to go to private hospitals which are unaffordable for most citizens. Even though there are optimist views, India's health infrastructure is dismal. Treatment in public and government hospitals is technically free. But the primary health infrastructure is so problematic that many people have to travel hundreds of kilometers to even reach one center. And even if they do, the hospitals are overburdened. India's government spends just 1.4% of the country's gross domestic product on health, a figure dismal compared to even underdeveloped economies. In the next few years, India will become the most populated country in the world, but one of its biggest challenges will be the health of its citizens. It needs investment not just in insurance, but also in public health infrastructure, especially its primary health care. Rama Nagarajan is health editor of India's leading daily Times of India. She says it's much more than a health insurance plan that can make a healthy young India.
You can have schemes like the National Rural Health Mission, you can have a National Health Mission, you can allocate funds for it. The funds will also be transferred to UP. And now what happens after that? What you use the funds for is basically, everybody wants to make more buildings. So you will find primary health centers being built, you will find sub-centers being built, you will find little hospitals being built, equipment being bought, no doctors, no nurses. There are empty, well-equipped things just sitting out there.
India's health challenges are massive. It's a country still struggling with issues like sanitation and open defecation, a perfect place for infectious diseases to breed. There are not many details available on how the government plans to fund the program, especially since India is struggling with high fiscal deficit. A young India is expected to be its strength, but a large population under the age of 35 that is not healthy and is unskilled could instead be a recipe for a disaster. Shweta Bajaj, CGTN, New Delhi, India.